So good afternoon and welcome to our virtual program, Easing Medical Fears. We're very grateful to have Natalie Riggio and Nicole Shaffery speaking with us today. A little bit about our speakers. Natalie Riggio is board certified behavior analysis at K. Hovnanian's Children's Hospital in Neptune, New Jersey. She holds a master's in special education and a BCBA certification from Rutgers University. Natalie provides behavioral support to patients in the emergency room, inpatient and outpatient settings, collaborating with staff to create individualized behavior plans. She is also co-creating hospital-specific tools and staff training to improve the healthcare experience for all patients with autism spectrum disorder and their families. Nicole Shaffery is a certified child life specialist at K. Hovnanian's Children's Hospital in Neptune, New Jersey. She holds a Master's of Science in Child Life from Bank Street Graduate School of Education. Nicole provides psychological preparation and procedural support to pediatric patients in the ambulatory surgery center and main operating room, while also helping to support pediatric patients throughout other areas of the hospital. Additionally, she helps coordinate visits for the Surgical Scrub Club program, which allows patients and their caregivers to learn more about what to expect on the day of the child's surgery before the actual surgery date. So with that, I'd like to welcome both of you and thank you all again for joining us. And I will turn it over to Nicole and Natalie.
Okay, so I'm briefly going to go over some topics that we will be discussing today during the webinar. So first, we'll go over what a child life specialist and behavior analyst is, how you can support your child before the visit, utilizing strategies during the visit, what you can do after the visit, as well as additional resources at K. Hovnanian Children's Hospital.
So like Allison said, I'm Nicole. I'm one of the certified child life specialists here. So I just want to start off by giving you brief definition of what a child life specialist is and kind of what we do here at the hospital and how we support our pediatric patients. You might see child life specialist written or certified child life specialist, means the same thing. Child life specialist is just kind of the term that we use when we introduce ourselves to patients and families. But we are certified. We do have to take we have to pass a certification exam. So that's why our official title is certified child life specialist, but it means the same thing. The textbook definition of child life specialist is a trained healthcare professional and expert in child development who helps pediatric patients and their families navigate the stressors and challenges associated with hospitalization, illness, injury, disability, and other medical related things. We wear many hats around the hospital and in the community. I put a few on here that, go over some things that we do in the hospital. There's a lot other things that go into our role, but for the interest of this presentation and what we're talking about, these are some of the most important ones. So we utilize theories of development to create individualized care plans for patients. We help prepare patients for different procedures while they're in the hospital, but also can be applied to outpatient as well. In addition to preparing patients for what to expect, we also provide support during those procedures, and we teach patients and also their families different coping strategies that they can use to have a positive experience during procedures and their time in the hospital. We utilize play a lot to help children learn about their experiences, process their experiences, and also to help express their feelings. And we don't only support the patient, we're also supporting their family. So we help support parents as well as siblings if appropriate. But overall, we're just an added layer of support in the hospital. We provide education and we help to advocate for patients and their families while they're in the hospital and in the community as well.
So a board-certified behavior analyst is a trained professional who supports children and adults learn positive behaviors. So BCBA teaches new skills and teaches positive behaviors by utilizing a science-based approach called applied behavior analysis, also known as ABA therapy. So, in the outpatient medical setting, the BCBA will offer the patient and family support by advocating for accommodations that might be necessary for a successful visit, such as shorter wait times, waiting in a quiet space, or sometimes even waiting in a busier space is preferred by patients. And if told ahead of time, the behavior analyst can provide direct support for the medical appointment. And we'll kind of discuss some more things that I provide during appointments.
So we're gonna kind of go over things like before the medical visit, during, and then after. And the information that we provide here can be applied to whether it's like a routine medical visit that you know about, or sometimes an unexpected visit when you have to come to the hospital or go to the emergency room.
So, when you have a medical appointment, it's important to keep this in mind. So, you want to understand the behavior. All past experiences shape the patient's behavior, which will direct how we manage the behavior to shape the patient's future behavior. So, what does this mean? So, if you have a negative experience in the pediatrician office, for example, last time your child had an appointment, they needed a shot and it didn't go well. So once you enter the building for the next appointment, your loved one may engage in unwanted behaviors. Doesn't necessarily mean aggression, but this can just be, becoming withdrawn from you or from the medical professionals due to their high anxiety. So, how can we be proactive and manage this behavior or other behaviors? So, we will be talking more about this throughout the presentation, but you can try to be proactive by preparing your child and the medical team for the visit. If you have a child that may engage in more severe behaviors, such as aggressions or self injury, it's super important you let your medical team know about this so they can prepare the environment to keep themselves safe as well as the patient and family. So this can ensure that you have a more successful visit, which then will lead to less stressful medical appointments in the future.
All right, so now I'm going to go over some common stressors and fears that are associated with the medical environment based on age and developmental level. Some of these can be applied to really any medical environment. Some of these are a little bit more specific to being in the hospital. Overall, among the different age groups, a fear of pain and harm is common, and often the fear of the unexpected. Age doesn't always dictate how a child will react to the medical environment. A child might be chronologically 9 years old, but developmentally may be like 4 or 5 years old. So obviously, you know your child best. So for infant and toddlers, some stressors include an unfamiliar environment, changes in routine, a loss of control, reduced autonomy. If they're in the hospital, they may perceive the hospital as a punishment, and also mobility restrictions. For preschool age, this magical thinking, so they kind of think in like these like very little literal terms. They might have these the illogical ways of thinking about why things are happening to them, egocentric thinking, loss of autonomy, changes in routine, loss of control, and at this age they can still view the hospital as a punishment and thinking that they did something bad and that's the reason why they're there. For our school age kids who have a little bit of higher level thinking compared to our preschool age, loss of bodily function and control, changes in body image, missing school and being separated from peers, which is more related to being in the hospital, and also limited opportunities to master tasks because they're in the stage of development where they want to feel like really independent and be able to master tasks on their own. And for our teen patients, some stressors include changes in body image, privacy, being separated from their peers if they're in the hospital, loss of bodily function and control, and missing school. So here's some different ways to help prepare for medical visits. Children tend to cope best when they know what to expect. But there's a little disclaimer on the bottom that some children are more information seeking and really want to know every single detail on what's going on. And some children prefer to know less information. So you can kind of just assess what your child prefers. And again, you know them best, so you'll kind of know what the best course of action may be. So the first thing is to have discussions with your child ahead of time, if possible. There are times when you might take an unexpected visit or have to come to the emergency room, but especially with like planned routine visits, having discussions with your child ahead of time is really helpful, so that they know what to expect. The timeline of when the discussion starts may vary. So for younger kids, typically about like a few days before. For older kids, it may happen a week or 2 weeks ahead of time, if you know. And sometimes it might be happening the day of. It kind of depends on what your child prefers, and if knowing information might be like a little bit too far in advance, sometimes that can increase anxiety. But again, every child's a little bit different. And if it's the first time, you may not really know right away. Provide honest and accurate information to the best of your ability. We don't want to lie to kids, but you might not know everything ahead of time. So a child may ask, am I going to get a shot? If the child is going to get a shot, you want to make sure that you're honest with them about if it's going to happen. And later on in the presentation, we'll go over some different ways to plan for that and coping strategies to use. But you may not know if the child's going to get a shot. So it's okay to say, hey, I'm not sure if you're going to, but let's ask the doctor when we get there. Utilize developmentally appropriate explanations. So a big part of our role is kind of taking these big like medical jargon and terms and breaking them down into child-friendly terms and language and more like layman terms. So here's just a few different examples of what you might say. So when you're talking about the blood pressure cuff, you might say it's going to give your arm a tight hug. Or if their child's getting a shot, we don't tend to really use the word shot, or like bee sting or anything like that. We'll usually say you may feel a quick poke. Kids, if you Google Kids Health, they have some really great resources for how to explain different procedures and things to kids in developmentally appropriate ways. And the big reason is why we don't want to lie to kids is because we're really trying to build trust. If you tell a kid they're not going to get a shot and then they go to the doctor and they get a shot, they're not only going to lose trust in you, but they're also going to lose trust in medical professionals. So visits in the future might tend to be more difficult. You can read books or watch videos related to going to the doctor or hospital or having a procedure. So these are just a few examples of different books that are out there, but there's plenty out there for specific procedures. There's Franklin Goes to the Hospital, Curious George Goes to the Hospital, the Bernstein Bears Go to the Doctor, the Magic Donut, which has to do with getting an MRI, and Goodbye Tonsils is what if a kid has to get their tonsils removed. When you watch videos, there's plenty on YouTube. It may not be specific to your doctor or your hospital, but it can just be helpful in giving your child a sense of what's going to happen. And social stories can be really helpful too. It kind of just outlines the sequence of events. And then engaging in play with your child using real or pretend medical equipment. So doctors' kits are really helpful for kids, especially with our younger kids. Play is really the way that we communicate with them. We kind of say that it's a child's language. It's the way that they process their experiences in the world. It's the way that we can help get them to express their feelings, and also it gives us a sense of kind of what's going on in their minds. So while in play, kind of continuing to assess the child's reaction and body language during conversations, and maybe offering breaks. If you think that it might be a little too much, you can always take a break and come back. But play is a really good way to kind of gain an understanding of how much they understand, and also if they have any misconceptions about going to the doctor or to the hospital. So this is kind of an example of something that you can create if you know ahead of time that a child gets a shot. This is something that, just an example of something that we use when we know a child has to get poked. It's called a poke plan. So it basically just, it can be used for vaccines, for blood work, or other painful procedures. And you sit down with your child ahead of time and fill it out with them. It gives them a sense of control and also helps to include them, in like decision making. And hopefully then you're able to use it at the visit to the best of your ability. So kind of determining, before the poke happens, coming up with a plan of whether they want to, like where they want to sit, taking deep breaths, picking a support person. When the poke is happening, these are kind of examples of different coping strategies, which we'll go into a little bit more detail during the presentation. And then after the poke happens, so something that they can look forward to after. So, the poke is something that needs to happen, but then they can look forward to something afterwards. And it can continue to be altered based on effectiveness of strategy. So you might go to an appointment and come up with a plan, and things don't really quite go according to plan, so then you can continue to adjust it for the next visit.
Okay, so this is an example of a checklist of some items you should consider to include in an emergency backpack. So the idea of this backpack is to have it packed and kept in a place so you'll remember to grab it in case of an emergency or even just a routine visit. So each backpack obviously will be customized to your loved one's needs. So, for instance, if your loved one at baseline is non-speaking, you might pack some visuals and a charger for their iPad if they use their iPad to communicate their wants or needs. Some preferred items that can provide comfort to them in the ER. So, for example, if they like headphones, if they get overstimulated, um, a blanket that they like, if you have two of them, maybe putting one and just having it in there. And especially having a lot of activities if you can pack in there, if you have extras, just because if you are in an ER, typically it takes a long time. If you're waiting for results or waiting to get discharged, this is ways to kind of keep them busy and you don't have to worry about going home and having someone else grab it for you. And also just having important paperwork back there. So if they're, in and out of the ER a lot, you can have like a list of medications printed out and left in there. So you don't have to stress about grabbing all their meds. So now we're going to discuss some things we can do during the medical visit. Okay, so listed here are some common triggers that can occur in a medical setting. As I go through each trigger, we will discuss a strategy you can try with your loved one. So once you find some effective strategies, it's helpful to make note of them just so you know for next time you can utilize them and it'll be used more consistently. Okay, so first, loud noises. So some things you could try do: speaking softly, turning off unnecessary devices, such as in our patient room, sometimes there's beeping, and you can see if you can learn how to mute them or discuss with your team positioning them a little further away so it's less loud. Headphones, soothing music, white noise, and a quiet waiting area. Strong smells is a common trigger, so offering your loved one a face mask, introducing preferred scents, sometimes clothing from home, or even a smelly sticker kind of block the strong smells of hand sanitizer or other strong scents from the medical setting. Try seeing if they have milder smelling items, if possible, in the hospital, and also an odor neutralizer, super helpful. If bright lights is a trigger, obviously turning off lights if you can, closing the blinds, adjusting monitors so they're positioned away, not bright in their eyes. Sometimes baseball caps are helpful, and sunglasses. If too many people in the room, especially, when you're admitted into the hospital, let's say, and there's a lot of residents and big groups, if you have a big team, it's important to let your team know so they can prioritize the staff that need to come in. So 1 to 2 or even 2 to 3 can make a huge difference. Rotating staff, taking turns speaking, minimize interruptions in the room so you don't have 5 people talking at once. That could be very overstimulating for really anybody. New people, so asking staff to identify themselves, try establishing a relationship with your loved one, interact with the patient, and if they could share a photo of themselves or if you can know ahead of time, just so you can help your loved one identify who's who. If touch is a trigger, explaining the procedure before, modeling it on a parent or modeling on a doll, having them warn the patient before touching them, allow the patient maybe to participate. So, if it's blood pressure, picking which arm they want it on, providing choices where they can is super helpful. asking if they can touch, if the nurse or doctor can touch a less intrusive area first, using timers or counting during the test so they know that it's going to end soon. Different textures, so assess the necessity of garments. Always ask, like, if your loved one doesn't like wearing a gown, seeing if you can have them wear loose clothing, say if it's a planned procedure and a dental procedure, let's say, seeing if they could wear like a loose shirt for when they have to attach monitors rather than having them change it to a gown. Using items from home, so blankets or pillows, and allowing patients to touch items, ask if they could touch things before it's used on them. Transitions could be another trigger, so offering choices when possible, using first in language, as Nicole said in the previous slide. First, we need to do this thing, but then we could do something preferred. Giving advance notice, either verbally or with visuals. That's why the emergency backpack, you kind of pack some visuals ahead of time for typical things like vitals is at every doctor's visit or in the ER. So having that visual ready to go to let them know, first we're going to do blood pressure, then you can take a break with your iPad. Using visual schedules is super helpful, especially if it is a planned appointment, because then you can call ahead and ask kind of the typical way things kind of work for that appointment. So when you come in, they have to do height, weight, blood pressure, temperature. Just knowing that, then you can provide some expectation for your loved one. And these are some other behavioral strategies you can try. So using distraction, so a favorite show, light spinner, pop-it, casual conversation about something preferred, listening to music, singing songs, counting bubbles. You really have to see what works best for your loved one. Modeling procedures and using timers has been super effective. Offering breaks and using visuals that we've discussed are very effective behavioral strategies to try. It's also important to identify what is a coping mechanism versus a negative behavior that you want to decrease. So any changes or increase in baseline behavior may be a way for the patient to soothe and manage sensory input or emotions. So some behaviors you may see are mouthing on inedibles, vocalizations, clapping hands, grinding teeth, humming, crying, flapping, yelling, rocking, pacing, spinning, and so many more. So some strategies to help your loved one process the environment and their feelings are offering them a break, providing them with some space, provide choices, removing any potential dangers, validating their feelings, letting them know that they're okay, offer them some comforting items, and also meet with your provider to see what the next steps are and waiting them out a little bit. So really explain to the provider, oh, they're rocking because this is a lot and they just need a second. They just need a break.
Here are some other strategies that you can use. So when kids are in like a medical environment, whether it be the doctor or the hospital, they often lose their sense of control. So maximizing choice making when appropriate can afford them a sense of control. So if you know of a visit ahead of time, or even if you have to go to the emergency room, encouraging the child to choose a comfort item prior to the visit, kind of like Natalie said, getting them involved in their care if appropriate. So would you like the shot in your left arm or your right arm? Or would you like to sit on my lap or by yourself? Here's some other examples of coping strategies that you can use. So like Natalie said, distraction can be helpful. So putting on their favorite video or show, using a light spinner, a pop-it, and just engaging them in casual conversation to distract them, singing a song, listening to music, blowing bubbles, etc. These are just some examples. There's plenty more. Something that we use a lot as child life specialists is non-pharmacological pain management strategies. So that little thing that looks like a bee is called Buzzy. That helps when kids have to get poked. So it helps to distract them from the poke, but also helps them to feel the poke less because it uses vibration and like the gate control theory to help block pain signals from reaching the brain. So the trick is to put it between the pain and the brain. So if you Google Buzzy, they kind of explain where to put it based on what the procedure is. engaging them in deep breathing techniques. Deep breathing helps to calm the body. So there's star breathing or hand breathing. So this is an example of star breathing. You inhale, hold it, and then you exhale. You can also use fingers too. It does the same idea. Looking or looking away during the procedure. So if they're getting a shot, some kids like to be in control and like to see what exactly is happening, and sometimes they look away. Either way is fine as long as they are doing their job of holding still, or whatever the procedure is. Holding their caregiver's hand. And something that we always say in our field is crying is coping. So just because a child is crying does not mean that they're not coping well. We actually encourage it. I know it's really, it might be instinct to tell them to don't cry, it's going to be okay, but you really want to identify the child's emotion and validate their feelings because if you say don't cry, that it might invalidate them and might feel like they can't express that. And crying does help to relieve stress too on the body. Some different things of how caregivers and parents can get involved. Advocating when appropriate, so advocating for counting down before the poke, for a comfort hold, which I'll go over in a little bit more detail in a few minutes, or utilizing one arm over the other for the poke. Comfort holds are something that we use with parents. It's a safe way to hold the child while also making sure that we're maintaining their safety. You can hold your child's hand, whether it's a poke or even if it's during vitals. Engaging child in a distraction technique mentioned above. Using positive touch. This can be really useful with infants. Verbal reassurance and comforting words. So some common things that we use in our field, but also that we encourage parents to use when they're helping to support, is letting them know that the child is safe. It's okay to feel scared. It's, even if they're being brave, they're also allowed to feel scared as well. Those two things can exist at once. And just letting them know that they're doing a great job. If you're praising, really being specific with it, like you're doing such a great job holding still, and it'll really make them feel good and gain more of a sense of control. Another thing that we use is something called One Voice. So One Voice it's actually an acronym, but the overall idea of it is that one voice is heard during the procedure. So a lot of times that's the parent is the one that's being the one voice during a procedure. In the hospital, if Natalie and I are involved, sometimes we're the one that's being the one voice, and it really could be anyone. It could be the nurse, but typically it's the parent or BCBA or child life specialist who has built rapport with the child. But again, it could also be another provider, and it just helps to foster emotional safety and create a calmer environment, both for the child and also for the parent. And one thing that we recommend to parents, it can be hard, especially when you're involved in a stressful situation, is if you remain calm, that will help your child to remain calm. They will feed off your anxiety. So if you're super anxious, they will also tend to feel super anxious. A little bit more about One Voice, I'll just kind of quickly go through what the acronym is. Like I said before, one voice should be heard during the procedure, needing parental involvement, educating the patient before the procedure, which is something that I went over earlier, validating the child with your words. I know this is hard. If it's something that they have to get a poke, offering a comfort position and pain management, individualize your game plan, choose appropriate distraction to be used, and eliminate unnecessary people not actively involved. So if you feel like there's too much people in the room, you can always try to advocate for people that might not necessarily need to be there at that exact moment. So this is a little bit more about comfort holds. So these are just 4 different examples. If you Google comfort holds, you can learn a little bit more about them and how to effectively use them. They're typically used, when a child has to get poked or, another painful procedure. So there's the side sit where the child's sitting on your lap off to the side and the arm that is needing to be poked is exposed. There's back to tummy sit, tummy to tummy sit, and also back to tummy table sit. So when you're in the hospital or when you're at the doctor's, you can always try to advocate for these and also practice them at home.
Okay. So after the medical visit, we'll discuss some things you can do.
So once a medical visit is complete, continue having conversations about medical visits. You really want to assess like what went well for the child. You might have used coping strategies, but they might have not seemed to be too effective. So trying to come up with a new plan for the next time. Can you continue engaging in play about medical visits? Children after the medical visit, through their play, you might learn a lot about how they felt about it, what their understanding is. They might still have misconceptions, and then that play can then be a good segue for different conversations. Continue practicing coping strategies, whether it's Buzzy, which you can get on Amazon. It is a little pricey, but it is really, really helpful, and we really love using it here. Note which strategies were effective during the visit and tailor it based on how things went, and working with your ABA team to desensitize on common medical procedures. Okay, so what services do we offer here at K. Hovnanian Children's Hospital? So like we said earlier, we do have child life specialists throughout the hospital. So we work in different areas. We have child life specialists. We have someone in our emergency room, on our pediatric floor, our pediatric intensive care unit, so the PICU, in our outpatient day stay unit, infusion center, and in our surgical areas, which is actually where my home base is. And we do often get consulted based on availability to other areas of the hospital, such as radiology. These are some things that we do as child life specialists throughout the hospital. Again, it's not every single thing we do, but for the purpose of this presentation, these are the things that are most applicable. So we provide psychological preparation for procedures, whether it be an MRI, CAT scan, IV, surgery. We provide procedural support for those procedures and helping to identify different coping strategies that can be used. We provide normalization of the hospital environment. So, your child may be here for a day, they may be here for 2 days, they may be here for 2 weeks. So we really try to engage them in play. We have a playroom, we have a teen lounge, and even if your child's unable to go to either of these, we provide like bedside play and different activities to do just to help keep them busy and keep their mind off what's going on in the hospital. Family and sibling support. So even if siblings are unable to visit the hospital, we really try to work to foster that connection when they're separated. We have the Surgical Scrub Club program, which is something that I help to coordinate. It allows the child and their caregiver to come to the hospital prior to the patient's surgical date to meet with me or another child life specialist if I'm unavailable. I help provide them preparation for what to expect on the day of surgery. And it just gives them a better sense of what's going to go on the day of surgery. Typically, I meet kids on the day of surgery, but Scrub Club allows them to just take more time to process what's going on so that the information is not thrown at them the day of. And we collaborate with the patient's care team to assist with meeting goals while they're in the hospital.
Okay, so the behavior analyst role in the services I provide. So for outpatient, so I will call the family 1 to 2 weeks in advance to collect enough information to create an individualized care plan. So that I will go over in the next slide. So I collaborate with the outpatient team to make any necessary accommodations for your loved ones. As we talked about earlier, shorter wait times, maybe for surgery, let's say they have to wait in the post-op area rather than the pre-op area if they're early in the morning, because post-op is usually empty first thing in the morning, and trying to figure out how to help the visit be as successful as we can be. And I work with Nicole a lot, especially in surgery, but I can provide outpatient support also for blood work, MRI, and other areas as well. For inpatient services, so I will come to the room to meet with parent or guardian to create the behavior care plan I'm about to go over and provide support for the patient's entire hospitalization by collaborating with the medical team and with child life.
So if you do have to come to the hospital, whether it be an unexpected visit or a planned visit, you can ask for a child life or a BCBA to come support you and your child.
Okay, so this is the behavior care plan that I create based off of the information that you will provide me, whether over the phone or in person if you are inpatient or in the ER. So it's just basic information that's important for our providers to know. So, how your loved one communicates, whether it's verbally or if they're non speaking, do they use visuals or their device, any behaviors they may engage in. So we want to keep them safe, especially if it's self-injury, knowing if we need extra padding, things like that. I also list preferred activities because our providers love knowing that. So if they prefer to be alone, that's good for them to know. But if they like coloring, kinetic sand, puzzles, Play-Doh, animal toys, they can bring stuff in for them, and that helps kind of build that positive relationship. I also ask for triggers just so that we're aware, such as in this case, being touched or having too many people. So I put that right on the door so we know to limit the amount of people in and out. And if being touched is a trigger, unfortunately, in a medical setting you are getting touched a lot. So we try to limit it, as well as using other strategies like providing warnings, showing the materials ahead of time, maybe engaging in medical play with our child life specialist, and offering fixed choices, whatever strategies that are most effective, which I would ask you. And then any signs of agitation. So we're not fully escalated yet. Like for this patient, they engage in severe aggression and self-injury. So we wanted to know what are some signs leading to that so we can try to de-escalate before we get to that point. So crying, it was a sign, and self-injury. So underneath that is the explanation of strategies, because I'm not always here. I'm only here Monday through Friday. And if they're inpatient at night, this is important for our staff to be aware of and understand how to utilize the strategies, as well as our weekend staff. And then on the bottom, I always let them know if they have any concerns, they can contact myself or the child life specialist. Okay, thank you guys.
Thank you.
Thank you, Nicole and Natalie. That was very informative and very helpful information. So at this time, we will take any questions you have. So please, if you have any, submit them into the chat and they would be happy to answer them. I know you did mention that these services were offered at KHOV. Are similar services also offered at Sanzari Children's Hospital? Do you know?
Yeah, we do. They do have child life specialists up there as well. And
they do have a BCBA up there, but our roles are slightly different. So she provides support inpatient and in the ER, and she does provide some outpatient support, but less frequently than I do. Mm-hmm. So you would just have to call in advance about the BCBA.
Yeah, and I know that the Surgical Scrub Club program is unique to KHUB. I don't believe they have something like that up there at this time.
Perfect, thank you. If anyone has any questions, please submit them in the chat. All right, I think we may be good. I mean, you guys provided a very detailed, informative presentation, so doesn't look like there's any questions currently. We did just get a comment, thank you. So we will wrap it up at this point. So I just want to thank you all again for taking the time to join us today. Please watch your email for an evaluation of the program. Please take time to fill it out. We'd love to hear what other topics that you're interested in. Again, you'll also receive the link to the recording so you can listen to it again or share it with others. And it'll also be posted on our website at hackensackmeridianhealth.org/kids. We will have other parent forum webinars coming up in the new year that we hope you'll join us for. So please visit our website to find out more information about these upcoming programs and others. Again, thank you, Nicole and Natalie, for this great information. And thank you all again for joining us. Have a great day.
Thank you for having us.